Welcome to Chapter 34, Multi-System Trauma. Very, very short chapter. It's like 10 slides, um, but it is something we need to talk about. Okay. So, so there's a difference between a multi-trauma patient and a multi-system trauma patient. A multi-trauma patient has more than one serious injury, and a multi-system trauma patient has one or more injuries that are serious enough to affect more than one body systems. So key things to remember is teamwork, timing, and transport decision. Um, you have to have those three things in order to make sure that your patient gets the proper care that they need. Patient severity. So most critical decisions are patient severity, whether to limit scene time or not, and which hospital or transport method is best for your patient. So that means how sick is my trauma patient, basically. How bad are they injured? Um, and of course, we always want to limit our scene time. Trauma patients should be no more than 10 minutes on scene, barring any kind of extrication or anything like that that may inhibit us from actually doing 10 minutes. And if that's the case, then maybe we need a different transport method, like a helicopter. Um, and getting that patient to the appropriate facility as well. So determining severity, so we have some physiological criteria that kind of helps us determine whether or not our patient is critical. Um, so altered mental status could be a head injury, anything with a GCS of less than 14, hypotension, could be shock or internal bleeding, with a systolic pressure of less than 90, and abnormal respiratory rates indicate head injury and later stages of shock. Anatomic criteria would be amputation proximal to the wrist or ankle, pelvic fractures, open or depressed skull fractures, paralysis, any kind of penetrating injury to the head, neck, torso, extremities proximal to the elbow and knee, um, chest wall instability or deformity, 2 or more proximal long bone fractures, crushed, degloved, mangled, or pulseless extremities. So all of this is the anatomic criteria. And then we look at the mechanism of injury. And we've talked about some of these things before. So in the absence of anatomic and physiological signs, then we want to look and see if our mechanism of injury is severe. So falls, okay? Falls greater than 20 feet, 15 feet, or greater than 3 times the height of the kid, okay? High risk auto crashes with intrusion, more than 12 inches, ejection from the automobile, death in the same passenger compartment, or telemetry data that is consistent. Older adults do not efficiently compensate for kids, and children may benefit from a specific pediatric specialty ER. And patients who are on blood thinners and pregnant patients. Okay, these are all considered into our trauma triage, basically.